All right. Good morning, distinguished speakers and respected participants. Welcome to the MHPE Friendship webinar with the theme Creating a Supportive Learning Environment for Students, Reshaping the Future. As we all know, this topic is very crucial as supportive learning environments empower medical students not only to meet academic demands but also to develop resilience, well-being, and strong professional identity, preparing them for the lifelong success in healthcare. It's wonderful to see you all, many dedicated educators and professionals joining us today. Thank you for being here and for investing your time in empowering our students' well-being and growth. I'm Latifa Putri Fauzia, and I'm honored to be your today's moderator. Before we move forward, let me share a quick look at today's exciting program. We will begin with our opening remarks and then hear from three inspiring speakers, each bringing valuable perspectives on how we can better support our students. After each presentations, we will have a short Q&A sessions. So please get your thoughts and questions ready. To officially open our webinar, we kindly invite the Director of Friendship, Dr. Yoyo Suhoyo, Master of Medical Education PhD, to deliver his welcoming remarks. Hello, Dr. Yoyo. Good morning.
Good morning, Latifa. How are you?
Okay, I'm good. How are you, doctor?
Fine, good. Super.
Okay. Okay. The time is yours, doctor.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, all. Thank you very much for all participants for attending this webinar. We skip for some months of the uh, MHPE friendship webinars because we plan these webinars will become regular activities organized by friendship and master in health professional education. Uh, with the goal for sharing experiences and best practices in the field of master in the field of medical and health professional education from all alumni of both friendship and also MHPE MHPE program. We can learn, we can also share, and as a part our effort to improve our medical and health professional education. So enjoy to all participants. We really hope you can learn a lot from this session, and then don't forget that for all of you who are not yet who are not alumni or not yet joined the friendship, we offer friendship fellowship program for 2026. We open the application or submission for application until the end of this month. So as soon as possible, just apply for friendship because we only open until 31st of December, and we already have a lot of attention. We already have some applications, and then please as soon as possible apply because we only have limited places for fellowship. We only open until 25 participants for next year. So please join for as soon as possible with friendship. Okay, and some of the some of the speakers are all alumni of the friendship, and some also both alumni of friendship and MHBE, and maybe there's some of you all just alumni of MHBE. And Latifa is both, right? Both friendship and MHBE.
Right, doctor.
Okay, so enjoy the webinar, and have a nice webinar. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. Yoyo, for the inspiring opening speech and also for the really interesting program that we will have in Universitas Gadjah Mada, which is friendship. You can check out it later. All right. Before we proceed, I would like to inform several rules for today's webinar. First, kindly keep your microphones muted during presentations, while you may type your questions anytime in the chat box. And we will have a short Q&A session after each presentation. So, let's begin our scientific program. Our first speaker is Dr. Patricia DC Andrea, MHPE. Let me introduce her CV. Dr. DC is a newly graduated medical educator and now is currently a staff in Universitas Kristen Duta Wacana. She completed her medical training at Universitas Kristen Duta Wacana and also graduated from the MHPA program, of course, in Universitas Gadjah Mada. She is also Friendship Fellow of 2024. Today, she will share a presentation entitled The Role of Learning Environment in Fostering Student Resilience. Please welcome Dr. DC. Hello, Dr. DC.
Hello, Dr. Latifa. How are you?
I'm good. How are you?
I'm great.
All
Thank you
right.
very much.
Ready, doctor?
Ready, set, go.
Okay, the
Okay.
floor is yours.
Okay, good morning, ladies and gentlemen. It's such an honor to be here sharing about resilience. I am Patricia DC. You can call me DC, but I hope this presentation won't make you dizzy. And I'm going to talk about surviving to thriving, the learning environment's role in students' resilience. Is my screen visible to all of you?
Yes, doctor.
Okay, thank you, Dr. Latifa. So I'm going to start this presentation with a very hard news, a very sad news that we all heard about it, that many of the university students committed suicide, and it's very sad. Maybe they have a lot of burdens in their shoulders that they cannot tell anyone, so they fall into this committed of suicide. And we know that when we enter university, we face new challenges, different challenges than before. And we need to have this one thing to stay strong and to go back and stand up taller and stronger. And it's called resilience. And we're going to talk about resilience, learning environment, and also the learning environment's role in resilience and practical implication about what we can do as educators. Resilience is a dynamic process encompassing positive adaptation when facing adversities, uncertainties, or stresses. So it's how we get back stronger, how we rise up after facing some challenges in our lives. And resilient students usually have engaged in effective coping strategies, maintain higher levels of self-efficacy, and persist through academic challenges. And with having these things, it will lead to the academic success and also well-being. And it is first thought that resilience is a fixed trait, meaning that if I have a low resilience, then I cannot do anything. This is who I am. This is what I am. You have to accept me for who I am. But as the research develops, it's actually not a fixed trait. Resilience is a dynamic process that can be developed and enhanced. And it doesn't happen overnight, of course. It needs more and more challenges to overcome to finally become resilient. So I'm going to share with all the ladies and gentlemen about the framework of resilience. Here is how resilience made. So it has to start with stressors or challenges. This is the key, and this is the activator, the initiator of being resilient. So if we ask God, God, I want to be resilient, please make me a resilient person, but we do not want any stressors or challenges in our life, well, God will not give us resilience, of course. So let's start from the beginning. It has to start with the stressors or challenges. After we face this, there's an interaction between our environmental, with our external factors, and our internal factors. For example, I am a student and I got an E for my exam. That is my stressor. Oh, I'm so sad getting an E on my exam. The environmental context and the internal factors will interact to each other. Environmental context consists of our family, culture, community, school, peers. Are they being protective to ourselves? Do they serve as our protective factors? Or conversely, they serve as our risk factors. This will make a very great difference. And also our internal factors. Do we have a really good cognitive skill, such as how to survive? Are we emotionally stable? Are we physically healthy? Behavioral and spiritual, this all will interact in ourselves. And when these two interact with each other, the external factors and internal factors, they will help us to have a different view to our stressor. They will help us to reframe the problem. Oh, I got an E. It's the end of my life. I cannot be a good doctor. It's the end. That will happen if we do not have a strong protective factors and strong internal factors. But if we have a strong one, we can see the stressor as an opportunity. For example, I got an E. Maybe I will have to study about this topic even more deeper. Maybe I need to ask for my friends to teach me about this and that because I need to learn better on this. I need to plan to study more about this. So the planning strategy is how we want to do something about it. It will happen if we have a strong external and internal factors, and we will adapt to the situation. When we succeed, we will reintegrate ourselves to become resilient. But if we do not succeed, we will fall into maladaptive reintegration, and we will talk about it now. So this is the resiliency model. It's the same as the previous one. So there is an interaction between the stressors and the factors that we have externally and internally, and it will cause a disruption. Disruption meaning that we fall into our hemostasis state. We fall into pieces. And there is a disorganization within ourselves. And how we want to get back up it's up to us. Yeah, we can reintegrate to be more resilient, meaning that the state is higher than our hemostasis. So we can stand up even better and stronger in overcoming another upcoming challenges. So when we reintegrate to resilient reintegration, when we face same or similar challenges, we are more prepared. We are more, we are stronger than we are before. But sometimes when the challenges are too, too high, the challenges are too hard to overcome, we manage to get back up, but maybe we go back to our initial state, the hemostasis state, and it's okay. It's called the hemostatic reintegration. And the maladaptive reintegration, meaning that we go down to our hemostasis state. The impact to our life is so bad, it's so big, and making us losing our protective skills, making us lose our confidence, making us lose our self-esteem. Then we go in maladaptive reintegration. And the last one, and this one is the saddest one, is the dysfunctional reintegration. It's when we cannot tackle down the challenges and we need a psychotherapy for that. Maybe the challenges were so bad that we have an idea of committing suicide or taking some substances or hurting ourselves, then we fail to reintegrate ourselves and fall into the dysfunctional reintegration. So where is the learning environment take place? It's in the external factors, and we were going to talk about this and how can we do as educators to make a very optimized learning environment so that will help our students to become more resilient. So what is learning environment anyway? Learning environment includes the physical, social, and psychological context in which students learn. And it involves the interactions within the faculty, the staff, and also the peers, and also the formal, informal, and hidden curricula. So it all happens in not only medical schools, but also in other contexts. Optimized learning environment can be defined as a place that can influence students' professional and identity development, which we'll discuss more in Dr. Christian Edwin's presentation later on. And it has a positive impact on humanism, achievement, and student learning. But conversely, poor learning environment can increase student burnout and distress. With low level of faculty support, non-collaborative environment, cynical residents or peers, for organized rotation, inadequate supervision, it all can add to student burnout and distress. And there's a study in China that find association between learning environment and resilience. And turns out learning environment has a positive association with resilience. And it proves that resilience is very dynamic and context dependent. And there are several things that they study on this study, and there are two things that are crucial in the learning environment that can affect resilience. First one is active learning. Second one is clear goals and standards. What is active learning? It's the interactive and engaging teaching practices that can support students in overcoming challenges. So when students are more engaged in active learning, they have sense of belonging to the class. They have a better self-regulation. They also improve their social and emotional skills because they interact with the teacher and with the peers actively, not passively. Two ways, not only one way. The second one is clear goals and standards. And when the teacher communicate the goals and the standards clearly to the students will be better at prioritizing tasks, engage more proactively, and maintain confidence when facing difficulties. So if the teacher gives the students the materials of the session before the session, the students will be easier to study first, to, I need to read more about this and then this and this, so that when the session starts, I will be more prepared. I'm confident enough to do the session. But conversely, appropriate assessment has been found to have a negative impact on resilience. Well, I need to highlight that this is in Chinese context because the summative assessment is more than the formative assessment. Why the formative assessment is not very much done in that context? Because of the limited time, and examination, GPA, academic rankings play a center role. And I guess it's not very different in Indonesia. Sometimes we have limited time to give a proper constructive feedback to our students and rely on the score, on the numbers, while actually they need some of our encouragement words, some of our feedback, while they do their things. So in this study, assessment has been found to have a negative impact on resilience. So what can we do? We need to have more and more active learning approaches. For you, ladies and gentlemen, who have not joined Framer, in Framer, there are a lot of active learning approaches such as jigsaw learning, group discussion, and role play and stuff, and that really engage with all the fellows, and it boosts our confidence and finally our resilience also. Second, clear goals and standard need to be communicated at the first, so the students know the expectation of the teachers while giving the materials. Faculty development programs, more summative assessments need to be done in this setting so that the students know what they can do next, what needs to be improved, and about their performance. And go back to the model, we can actually do 4 interventions according to the model. So the first one is the enviro-social protective processes. So even before the students face any stressors or challenges, we can provide them with a condition that can buffer impact of the life events. What we mean here is that we can provide a loving and an optimized learning environment so that even when stressors are coming, there are life events or challenges that happen in the students, they have a loving home. They have a strong foundation in their learning environment. We can do it here. But what if the students have fallen into the disruption? We can do something too in the enviro-social enhancing process. Help the individual to develop skills to negotiate effectively without experiencing major disruption. But what if they have come to the disorganization and fall deeper? We can allow the fall, but not life-threatening or permanently damaging. Sometimes we just have to allow the fall so that they will learn to, but we are there to support them. Next, if they can reintegrate themselves and they want to put their life back together and start over, we can support them with solving their with identifying the solution, helping them solve the problem, and encourage resilient reintegration. Maybe the first one we can do by providing a protective learning environment, an optimized learning environment. But the second, third, and fourth, we can use the help of the counseling unit in the university or the academic counselor because they are closer to the students personally. But if we are not part of the counseling unit, we are not part of the academic counselors, doesn't mean that we do not have the role here. We can raise our awareness, our sensitivity, our empathy to know which student needs help, and we can approach them personally, or maybe we can send them to talk about their problems, their problems to the academic counselors probably, or the counseling union. So what I would like to say here is that disruption is not a failure. Rather, it's an opportunity to become more resilient. The more we succeed in overcoming the challenges, the more resilient we will be in overcoming another challenges. And it's also a reminder for all of us, not only to the students, but also to the educators. Sometimes this is what resilience looks like. Sometimes we need to fall down, we need to break into pieces before we can reintegrate into a stronger version of ourselves. And it's okay to take your time to let your tears out, to have a time for yourself, to plan for your better future, to have time. And we hope that we can change, we can transform from a survival mode, from being just alive, just survive, just do whatever that is in front of us and survive, into thriving. We can develop our growth mindset. We can grow into a better self and reaching for the sun like the tree, like the living tree, reaching for the sun, reaching for the light. So it is the end of my presentation. I'm very honored once again to be speaking here, and thank you very much. And I'm very open for some maybe ladies and gentlemen have stories about being resilient or facing students with challenges and stuff. So thank you very much.
All right. Thank you very much, Dr. DC, for the insightful presentation. I just knew about the resilience framework from your presentation. It's really interesting. And we also have learned that learning environment is correlated with resilience. Thus, we should optimize learning environments in order to develop resilience in students. Okay, now we open the Q&A session. So for those of you who want to ask to Dr. DC, you may raise your hands or just type your questions on the chat box. Okay, we have one participant raised his hand. Okay, please, Dr. Christopher David, you may ask questions.
Okay, good morning, Dr. DC, Dr. Latifa, and friends. Thank you
Good
for the
morning.
opportunity. It was a very interesting and amazing presentation. And I would like to maybe pose a question. I've been wondering about the phenomenon and the controversy of tough love in medical education. So, from personal experience, I've witnessed a common perspective among medical educators or teachers in medical education that they think in order to build resilience, they need to be tough on their students. They need to maybe build their mental strength. But sometimes this kind of perspective lead them to be rude. I don't know, intentional or unintentionally rude, and maybe provide students with excessive workloads, but they disguise them as tough love. Do you think that this kind of approach, this kind of behavior is acceptable in medical education? Do they have any place at all? I would like to know from your perspective. Thank you.
Thank you very much, Dr. Christopher David. Can I answer it now? Okay, so Dr. Christian David was asking about the controversy of tough love. Is giving excessive workloads and being killer teacher to our students are included as teaching them resilience? Well, actually, being a medical student, ourselves are already full of stress, right? I mean, without having the killer teachers, without having teachers who give even more excessive workloads, it's actually already stressful. Maybe I can understand that they want to make our students become tougher, especially in this strawberry generation, strawberry generation era. But actually, we need to be wise in giving them excessive workloads, in my perspective, because sometimes we need to know the capacity of our students. By giving them excessive workloads, sometimes it will just burden them, and they come to the point that it's too much. I cannot plan. I cannot do a great planning about their loads. Then they will give up. They will maybe some of them will be triggered. Some of them will reintegrate themselves into resilient reintegration, but maybe some of them will not. Some of them will reintegrate to the lower of their homeostatic state. So I guess we can give loads according to their capacity. I mean, we know about the cognitive load theory, right? When we give a lot, it will just stay in their working memory and then will not be stored in their long-term memory. So we need to be wise on giving them that. But that doesn't mean that we are spoiling our students. We need to be wise on that. Dr. Christopher David. Thank you.
Okay, thank you so much, Dr. Rizzi, for the response.
All right, Dr. Christopher, do you still have more questions?
I think that's enough. Thank you.
Okay, you're welcome. And we also have several questions on the chat box. I think I will read on one, and then the rest maybe we will discuss it on the discussion panel later. Okay, so for Mr. Dodi Nursanto, he asks, what role do formative assessments play in building resilience in medical students compared to summative assessments, especially in terms of reducing burnout? Okay, Dr. DC, you may answer.
Yeah, thank you very much, Dr. Latifa. So, Dr. Dodik, what role do formative assessments play in building resilience compared to the summative assessments? So, the summative assessments sometimes are very burdening the students because they have to have a good grade to pass to satisfy their parents, but they do not know what they do, what have they done better, good, and what needs to be improved. In formative assessments, it includes giving constructive feedback. Maybe we all heard about the burger model of feedback. By giving them the positive first, and then what needs to be improved, then we cover up with what next, what can they do next to do better, to perform better. This will help the students to know, oh, so I actually have this area to improve. I actually have very good communication skills. I actually are excellent in doing the procedure, but I need to improve on this and that, this and that. So they know and they can plan it better for the next upcoming performance. So that will reduce burnout. If they just give, if the teachers just give a number of score without any formative assessment, without any feedback, then they will, oh my God, I got an E. What did I do wrong? What can I do to improve? They will not get that answer. So that will enhance their burnout rate. Thank you.
Thank you, doctor, for the answer. Yes, I really agree that formative assessment is really important, not only summative assessment, especially to reducing burnout, because we can give constructive feedback to the students so they know what they have done good and what have done not really good, and so they can improve it. All right. I'm so sorry for the rest of the participants who want to ask to Dr. DC because we are running out of time for the first speaker. But don't worry, we still have panel discussions after their speaker, so you can also ask them on that session. So please give round of applause to Dr. DC for the presentations. Thank you, Dr. DC. But stay still. We still have a panel discussion after the third speaker.
Thank you very much, Dr. Latif.
Yeah. Okay. Next, the second speaker will joining us, Dr. Christian Edwin, MHPE FFRI. He's a medical doctor from Universitas Maranatha and also Friendship Fellow 2022. He's actually my classmate in MHPE program in 2021. Hello, Dr. Christian. How are you?
Hello, Dr. Tifa. I'm fine, thank you. How about you?
Okay. I'm fine too. Long time no see.
Yes, nice to meet you.
Yeah. Okay, so Dr. Christian will deliver topic with the title Resilience and Development of Students' Professional Identity. So it's still about resilience. Okay, Dr. Christian, are you ready?
Yes, Dr. Tifa, thank you.
Okay, time is yours.
Okay. Hello, everyone. I want to share my screen first. Okay. Is it clear, Dr. Tifa?
Yes.
Okay. Thank you for your introduction, Dr. Tifa, and thank you for the committee for the invitation. And good morning, everyone. Today, I'll be sharing from my insight about resilience and the development of students' professional identity. Uh, and this presentation maybe integrates evidence from the recent research in health profession education, and also we will look at how resilience and professional identity formation interact to support well-being in our learners. Thank you also to Dr. DC for your enlightening uh, session about resilience and the learning environment. So before we dive in, let's start with a quick reflection using Zoom reaction. Think about your student, or maybe you can also think about your training experience before and which of this feels most familiar to you. Maybe you can choose the four reactions. First, for the thumbs up is if you feel that students are resilient, but their identity formation still fragile. For the heart emoji is if you feel that students have strong identity, but struggle to maintain resilience under pressure, or the hand clap for if you often see both resilience and identity grow together over time, or thinking face if you're still trying to understand how resilience and identity interact in your context. Okay, maybe I can't see about your reaction. Is that any reaction, Dr. Tifa?
Yes, there are a lot of reactions here. It's
Okay,
mixed between thumbs up, heart, and clap. Oh, but
okay,
there's also open mouth. So yeah, it makes four of them.
okay. Thank you, Dr. Tifa. Wonderful. Thank you for your reacting. This has helped us to see about how our experience or even about ourselves or about our students, and we can go to the next section. Okay, so today session will explore four parts. The first one will lay the foundation about what is professional identity formation and why does resilience matter, and then we will look at the key evidence, what research tell us about the identity, personality, resilience, and well-being. And the third, I'll introduce an integrative framework that ties all of this together. And finally, we'll talk about practical strategies, what we can do to our classroom, to our mentoring session, or our clinical settings in our home base. For in this first section, I'll briefly outline what we mean by professional identity formation and why resilience is a critical component in its development. So, professional identity formation or PIF is more than learning skills or passing exam. We know some students have maybe had a moment when they said, first say, I feel like a nurse or I feel like a doctor. Uh, it can happen in their study, in their clinical era, or in their academic era. And we know that identity doesn't form overnight. It is dynamic, social, constantly evolving, and shaped by what student experience, the role model they follow, or the values we reinforce, and the kind of culture we create. Also, like Dr. DC previously said about. When a student shadows a clinician who embodies compassion, professionalism, and integrity, the student doesn't just learn what to do for their future, but they also learned who to be they want to be in their future when the educational era is finished. And why PIF matters so much? Because when a student has a strong, coherent sense of who they are as a professional, several things happen. First, they feel connected to the profession they belong, and then they behave more ethically and consistently, and perhaps most importantly, they are more protected from burnout. A strong identity acts like as anchor, even when the wave of stress comes, like exams, especially like the Dr. DC said before, summative assessment, and then passion loss in the clinical era, conflict, self-doubt. Maybe their identity holds them steady if they have a strong identity. In other words, we can see that PIF is not only academic, it is a mental health intervention. And now about resilience. Dr. DC has had already tell us about the resilience. People often think resilience means being tough or not breaking down, but resilience is actually about recovery. It is the capacity to bounce back and to adapt and also to learn from the adversity like Dr. DC explained us. Our students face an intense environment, high standards, emotional cases, constant assessment, especially the summative one, and without resilience, they may internalize failure and lose confidence. But with the resilience, maybe those same challenges become not a failure, but become opportunities for growth. And for the last one about the resilience, we know that resilience and identity are tied together. Resilience provides the inner strength that allows identity to grow. And we'll see about the 4 key studies that help us understand the connection between personality, resilience, leadership, meaning making, and PIF. From the first study, this study is conducted by Tobasi and colleges. The study will explore how professional identity formation or PIF relates to burnout and mental health among medical students. The study showed us something powerful. A student with a stronger professional identity has less emotional exhaustion, lower burnout, and better overall mental health. And think about that for a moment. We can see about this some enlightening, powerful research result and their identity, our student identity, the story that they tell themselves about who they are becoming directly shape their well-being. When we help students from form identity, we're not just making them better professionals, we're also protect them from their mental health. And for the second articles or this second study, this study by Wu et al. In 2024 examined more than 1,300 nursing students in China. This article want to understand how personality types influence resilience and identity. The personality profiles identified by 3 profiles: the oversensitive, ordinary, and flexible. And, and the results is the student with flexible profile, those who can adapt when they see or they meet with the adversity, had both the highest resilience and the strongest professional identity. The fascinating part is in this article, we see that resilience was the bridge. Resilience mediated the relationship between personality and identity. So in the other word, we can see that personality isn't destiny. Even if a student feels insecure, anxious, or unsure, resilience building intervention can help them shape a strong identity. And for the third study, the study by Ryan et al. In 2024, the study used confirmatory factor analysis to test how professionalism, leadership, and resilience combine to form PIF. In this study, it's a quite large participant participated by over 1,300 medical students, confirmed that professional identity formation is a higher order construct that's supported by the three pillars. First, there's professionalism, and then there's a resilience, and also the last one is leadership. In the three factors, three construct, three pillars, we see that resilience showed the strongest contribution after the refining the model. And this reinforces the idea that resilience is not optional. It's a foundational to how students make sense of themselves as professional. And for the last study, for the last article that written by O. Twatide and the colleges, this work was to explore how meaning-making practices like reflection and narrative writing, or maybe narrative sharing, like we have in the FAMER, we have later learning circles, it can shape professional identity. This study highlight meaning making, something we don't talk about enough, and students develop identity by integrating their personal values with the values of the profession. Reflection, journaling, narrative writing, mentorship, it all can help students connect their inner world with the professional world. And the connection, that sense of meaning, protects motivation and reduces stress. With these findings, we can now look at how integrated framework that shows how resilience, professionalism, leadership, personality, and meaning making together shape identity and well-being. This framework brings everything together. I try to uh, make some framework after I read the four article or the study. The identity formation is shaped by resilience, professionalism, and then leadership, personal personal in meaning making, and personality traits. They are separate side. They're not separate. They are interact and they reinforce each other. And at the center, there are PIF, which then flows into the well-being. It means that the stronger the identity, the stronger the student's psychological foundation. So what's next? What we can do as educators. When we think about supporting our students' professional identity, it's easy to jump straight to curriculum changes or assessments. But in reality, identity grows through human connection and meaningful experience. So one of the most powerful ingredients is mentorship. Those small moments, maybe when a student see their uh, senior clinician, they can see how their senior clinician saw the compassion, humility, and professionalism to their patient. And also reflection. Reflection also play a huge role. When a student write, talk, or think through their experience, they begin to understand who they are becoming. And we can also shape the identity by giving student authentic experience early on, a moment that allowed them to feel useful, trusted, and part of the clinical team. And of course, resilience training matters. Teaching students how to manage stress, adopt a growth mindset, seek support, and recovery after setbacks. It also can help building resilience and also building the formation of the professionalism identity. And finally, leadership. Leadership opportunities give students the agency to step forward, contribute, and feel that their voice matters and they're not alone, and it can help how they becoming. These strategies, when combined, create the environment where identity and resilience naturally flourish. And like Dr. DC said before, even with the good strategies, students do not thrive in an unsafe environment. We need to reduce the hidden curriculum conflicts, build psychological safety, model healthy coping, and promote belonging. And identity grows best in a culture where students feel safe to make mistakes, safe to ask questions, and safe to be themselves. And for this summarize, first, resilience and identity are intertwined. You cannot build one without nurturing the other. And the second one is a strong identity protects students from burnout. And it means that it gives meaning and emotional grounding. For the third one, PIF is a multidimensional. Professionalism, leadership, meaning, and personality all play a role. And for the last one, interventions work. Our intention strategies from mentorship to reflection truly shape the identity. Maybe that's all. We have explored how resilience and identity shape our students' growth. And now maybe I love to hear your perspective. What moment you have seen where a student's identity or resilience was particularly tested or strengthened? And what strategies or environment have you found most helpful in supporting them? Please feel free to share your experience or question, and let's learn from each other. Thank you.
Okay, yeah, you're welcome. Thank you very much, Dr. Christian, for the comprehensive and engagement presentation. We just learned that resilience influence professional identity formations besides professional leadership, personal meaning, and personality traits. There are also several strategies that Dr. Christian already mentioned before, and we can try to develop it in our own institution. So now we open a Q&A session. So just like the previous session, we are open for two questions first. Okay, so you may raise your hands or just type your questions on the chat box. Or maybe not question, maybe also sharing experience, right,
Sharing,
Dr.
yeah.
Christian? Yeah, sharing experience in your own institution while you try to develop the students' professional identity formation. Okay.
Maybe
So
you have.
while yes.
Okay.
Okay, while we're waiting for the questions, perhaps you want to share in your institution how your institution try to develop a professional identity of students?
Okay. So in my institution, maybe there's not yet have a formal education strategies that we have, but in Maranatha Christian University, we have some support that students can ask. We have the dosen wali or what we said in as
Mentorship, academic mentorship.
mentorship program
Yeah.
and academic mentor. So when students have some adversities, they know who they can go to ask or to curhat maybe like that, and maybe that reflection also developed in that mentorship program also.
Okay, so academic mentorship program or in Indonesia we call it perwalian or
Yes.
pembimbing akademik. It's a very important supportive support one of the supporters to develop students formation professional identity, right, Dr.
Yes,
Christian?
true.
Okay, so we have two questions. So the first one from Dr. Dodi Nursanto. Uh, what role does early support for professional identity formation play in preventing burnout, and how can this be effectively implemented in medical curricula?
Okay, thank you for the question, Dr. Dodi. For the early support first, we can have a mentorship program. It also can help students to know how the journey that they will engage in, and also maybe we can tell them about the how professional uh, goes within the days, or maybe we can send our student in first year era to the hospital to observe our clinician about it, so it can helps gain the motivation maybe, and uh, it also grow their professional identity, so it can be strengthened over their journey, and maybe it also can help to reduce or preventing the burnout. And also when they see or they uh, meet the adversity, we can influence them to how they can help themselves, maybe for the inner motivation, maybe it's more can help. I think that's all, Dr. Tifa.
Okay, so the early support maybe like for the new students, they can have early clinical exposure, right? So they know how the
Yes.
professionalism of a doctor, and also they can also seek help when they have problems. One of them is maybe ask the solution to the academic mentor, right, Dr.
Yes.
Christian? Okay, thank you for the answer. And we goes to the next question. Although there are 4 questions on the chat box, but I'm sure I will only read for the next one, and the rest will be answered on the panel discussion. Okay, so the next question is from Dr. Ahmad Yarzik. Dr. Azik. Hello, doctor. Thank you. Okay, I believe that resilience is one of the core skills that real learner need to have during their learning process. And we already know that there is no exact subject teach the resilience or how to have strong resilience. So do you have tips how to build the resilience during the learning process to our student, especially for the medical student which have not enough time to break because of their tight schedule? Okay, please, Dr. Christian.
Okay, thank you for the question, Dr. Asik. And for the tips, how resilience building in the tight schedule for our medical students, maybe we can embed it in their activity in outside the academic. Sometimes I think in every medical school they have some activity that uh, students play more role, like in the senate or the executive uh, students body. It can embed it in the resilience building. So I in our uh, curricula, it can embed it in the formative also, in how we as educators give our students feedback to support their resilience, or maybe if we want to embed it in the students academic activity, it also can uh, try or put in their growth in the soft skill. So beside the tight schedule, our student also can help or their resilience can build also by the little program that we can embed it in that activity. I think that's what I can share, Dr. Tifa.
Okay, thank you, Doctor. So we can embed it maybe a little program to the curriculum to develop resilience. And other than that, every institution must have like students organization or maybe
Yes.
extracurricular activities. So our students not only just focus on academic activities, but also they can also like try their hobbies, maybe like sports or maybe in music and or maybe in like in students organization. So we hope that it can build their resilience.
Yes. True.
Okay, thank you so much, Doctor, for the answer and for your sharing. I'm sorry that your time is up for this second session. Please give a round of applause for Dr. Christian, everyone.
Thank you, Dr. Tifa. Thank you, everyone.
Okay, thank you. Okay, then we goes to the third speaker. Last but not least, our final speaker is Professor Dr. Ashish Goel. I hope that I pronounce your name right. He's a Friendship Fellow 2024, and he's currently staff in Dr. B.R. Ambedkar State Institute of Medical Sciences, India. He will bring a topic entitled Student Well-Being in Higher Educations. Hello, Dr. Ashish.
Hi, good morning, Dr. Latifa, and good morning, everybody. Thank you. You have pronounced my name absolutely correct, and there is nothing wrong in that pronunciation. I hope
Okay.
I do equal. I pronounce things appropriately and accurately in the next 15 minutes of my presentation. Thank you. So
Okay, thank you, Doctor. Yeah, the screen is yours.
So I would be talking about student well-being in higher education. And as we all are aware, primum non nocere. So that's the Italian phrase that we all have been brought up with, that first do no harm. So that's precisely and exactly what I'm going to talk about in the next 15 minutes. As an overview, I would be talking about in the beginning about my own teaching philosophy. As we are talking about student well-being or student safety, I will be talking about the spectrum of what is a student, what is safety, what is education, and what is meant by higher. I would talk about the paradox that we live in. And after Dr. Christian's talk on resilience, we will try and move from resilience to system redesign. And I will be talking about some maxims for creating safe learning environments for our students. But most of our focus will be on teacher-student or facilitator-learner interactions. So let me begin by talking to you about my own teaching philosophy. So if we use this as a graph, and here on the x-axis, we have the time, and on the y-axis, we have success. Now, success could be achievement or whatever way the student and the teacher would like to define success for the student. So here we have a student who moves in time from point A to point B. So over time, any student with or without a teacher should be able to move from point A to point B. Now, my role as a teacher, T, if there is an intervention at some point of time in the teacher's career or the student's career, there should be a movement after my intervention from B to C. So instead of the student going to point B, I should be able to take the student to point C. Only then I am good or I am effective as a teacher. So with that background, I would like to talk to you and would like you to think about what is a student in higher education. Of course, we are talking about medical education, but are we talking about an undergraduate student, a postgraduate student, or a doctoral student? Or maybe the doctor who's a forever student? Any doctor needs to learn not once, not twice, but every day and all the time. So coming to the paradox, what we have been taught as the primum non nocere has been for patients. But what about students? We need to extend this same concept to students because student safety is antecedent to patient safety. And I believe that unsafe learners cannot provide safe care to the patients. Now, what is safety? Although in medical education, we only talk about safety in the classroom when we are talking about undergraduate students, but the safety encompasses a larger and a wider concept for the postgraduate student working in a clinical environment, for whom his workplace becomes his classroom. That is where they learn and they actively are involved in patient care. So sometimes there are visible physical risks, which could be undeniable biological hazards. Of course, clinical curiosity has a biological cost. A student working in a clinical environment often has a payment of a biological cost in terms of needle stick injuries, exposure to infections like tuberculosis, patient violence, or hepatitis B, hepatitis C, or n number of different scenarios and infective agents that they are exposed to every day. Then, of course, there are some invisible risks. There is a hidden curriculum. There is burnout. There is psychological problems or the components of safety. There is suicide. There is gender harassment. There is burnout. And then culturally, there is mistreatment or there is a hidden curriculum that we live with. So I will not talk about all of these, but I would like to draw your attention to a few of them. Geography determines the risk. There is a global gap in the equity. The global data says that the needle stick injury prevalence is about 56.2% of the actively working doctors or students in the clinical care domain. But in the developing countries, 38% of the students report injuries, whereas in the developed countries, only 21% of the students report these injuries. So clearly, the geography of where you are working often determines the risk of how much you have a chance of a needle stick injury. Now, there is a regulatory response. The World Federation of Medical Education globally, the General Medical Council in the UK, or the Liaison Committee on Medical Education in the United States, all have mandated safety and well-being of the students and in medical education. However, there is a gap between what can be achieved and what we live in the present. There is a holistic and tech approach, which is there, which we will talk about in a little while. And so I would like to leave you with a few thoughts that should kind of keep you occupied for at least the rest of the day today. These are words by famous or some infamous or some people whom you might not know, but definitely they are worth thinking. So Alan Clark says, get the learning environment right, and the learning will look after itself. So we've got the right environment. If we got the right safe space, learning will happen and the students will learn. So Tiberius and Sinai in their article have said that educational processes depend upon good relationships. We learn best from people we care about and from people who we believe care about us. So try and think of your life as a student. So whatever be your age and whatever be the stage of professional career you have been in, there has been a time when you have been a student. Think of that time and think of the best teachers that you have had encounters with, that you have met, and the teachers that you remember. I'm sure that the best teacher that comes to your mind will not be the one who knew the subject or who told you a lot, who taught you a lot, but will be the teacher whom you felt that who cared about you. So for that, let me ask you, how many of you know the names of all your students when you were teaching in a large classroom? There is an old adage and an old saying that there is no correct without connect. So unless you are connected to your students, you cannot correct them. You cannot change the way they work. You cannot change the way they learn, and you cannot change the way they behave unless you have developed a connection with them. If there is no connect, there is no correct. So unless you have a relationship with your students, you are not going to do any good to their learning. Barry Wade says, pain from words left its scar on mind and hearts that's tender. Cuts and bruises now have healed. It's words that I remember. So more than what we teach our students, what matters is what words we use to them when we are teaching them. Please don't use fear, threat, sarcasm to establish control in your class or to hide your own shortcomings. It's been found that humor related to sarcasm and mockery is not an effective technique for teaching medical students. Laugh with your students and not at your students. John Maxwell says that students do not care how much you know until they know how much you care. So it's not about how much knowledge you have, your expertise in the field. It's not, the classroom is not a place to show off your knowledge. We don't need to become just the expert authority. It's important that we are experts, we know the content, but it's not the sufficient exercise. It's not enough. It's not the only thing that is required to help students learn and engage with you. Don't worry too much about what needs to be taught. Make the effort to know who is there to learn. The how will automatically follow. I come to Jay Finkelstein, who says, when we consider the practically universal use in all educational institutions of a system of marks, we can but be astonished at the blind faith that has been felt in the reality of the marking system. So we all know how we evaluate papers, how grades are given, and how fickle and how difficult it is, and how unreliable the system is. However, it is the assessment that derives learning. It drives learning. Assessment is but beyond grades. Grades are not a reflection of an individual, of the student. It's important that you assess not learning or knowledge, but assess the student's potential, their effort, and their improvement that they have made over time in your care. Albert Einstein said that everybody is a genius, but if you judge a fish by its ability to climb a tree, it will probably live its entire life believing that it is stupid. Barry Wade again says, stick and stones may break my bones, but words can also hurt me. Stones and sticks break only skin. Words are ghosts that haunt me. So be careful how we speak to our students. Charles Kettering has said, high achievement always takes place in the framework of high expectations. So unless we set the expectations right, the achievement will be low. This largely derives from the Pygmalion effect. When people believe that something will happen, they subconsciously alter their actions to make it come true. Make your students aim for the moon. They will probably reach the stars. Well, personalized and individual planning is important in this because goals need to be set one-to-one with the student so that you don't overrate the goals or you don't underestimate the student's potential. And it's an important teacher's task to identify the right goals that you set for the student so that they continue to remain motivated without being demoralized or disturbed or disappointed when they do not reach them. So it's a double-edged sword and has to be dealt cautiously and carefully by teachers. Henry Ford says that coming together is a beginning, staying together is progress, and working together is success. What it implies is that in your classroom, we need to encourage teamwork, develop classroom communities, and we need to assign tasks to students that make them depend upon one another so that they learn in creation and co-creation and co-development with each other. Ignacio Estrada has said, if students do not learn the way we teach, then we need to learn the way to teach them in the way they learn. In other words, unfamiliarity with tech, which is whatever is latest and whatever the students are using to learn, leaves you unconnected with your students. And as we saw, if you are unconnected or if you are disconnected, then learning does not happen in the classroom. Finally, I would merely like to say that a creative teacher in an innovative classroom using technology provides an optimum learning environment for millennials and centennials. And if there is one message that you can do and take back from this presentation, and that you can do at your own level in your classrooms, when you're making a large classroom teaching or a large classroom lecture, learn your students' names, and you will see that it will make a difference in the learning environment that you are providing to the student. Thank you. I will stop here, and I'm happy to take questions if there are any.
Okay, thank you, Dr. Ashish, for the very insightful presentations. While I'm listening to your presentation, I'm self-reflecting whether I already done enough, good enough as a teacher. Thank you very much. So we will have a Q&A session for this third session. So for those of you who want to ask anything to Dr. Ashish, please press your hand or just type your questions on the chat box. And actually in the chat box now it's also there is a fruitful discussions about how to build resilience or professional identity formation and also students' well-being in medical school, especially in lower middle income countries, maybe like in Indonesia, and also with the whether while the students already have tight schedules and then the teacher also have tight schedules and so many works to do. So maybe Dr. Ashish has also opinion about it, like how can we try our strategies to build resilient students' well-being and also professional identity in this constrained situation.
So I didn't follow quite appropriately what you were trying to ask about resilience and professional identity in terms of a safe learning environment. You want me to talk about a safe learning environment and how people develop resilience and identity?
The strategies that may as a medical educator we can develop some strategies to of course it's related to the good learning environment, but maybe you can also share your experience to build like the real strategies to do it.
Oh, so that's one of the strategies that I talked about was trying to develop a connection and a relationship with the students. If you make an effort to learn their names, you realize that you automatically connect better with them. In the West, where the systems of hierarchy are not so profoundly developed as we have in our countries or in the region, in the Southeast Asian region, students go out with professors. They are on first name terms. So the student need not call a Dr. Yo-Yo. He will directly call Rahma or Yo-Yo, or they will not be calling them sir or madam as we have the culture in our areas. So that develops one kind of a relationship with the student. The second strategy that I can advise is about feedback. feedback, the way we give feedback is instrumental in how the student develops or understands themselves. So what I have found, even while correcting the logbooks of students, as I do them personally, even a batch of 100 students, instead of writing just the grades or the marks that the student obtains on their record books or logbooks, if I write a couple of lines of personal message to the student saying that I expect you to do more and that you have more potential and you can work harder than you have been putting, and there I would look at the improvement that happens in the next uh, uh, time you submit your logbook. It makes a difference. The kind and quality of work that the students submit in the subsequent attempts have definitely made a difference. Then innovative ways of teaching and developing a classroom environment. I know one of my colleagues and professors who gives the students smart learning coupons. Whenever a student answers a question in class correctly, they get a smart learning coupon. And if anyone gets more than an n number of smart learning coupons during the entire semester, then the teacher takes those students out for a coffee or an ice cream, and that creates a different kind of a learning environment. So resilience is not something like Christian was saying. It's not that the student will never break down, that the student will never be disappointed, or the student will never have a failure. It's about how the student recovers from that failure, how quickly the student can come out and come back to his normal routine and can swing back into action. So most as good a learning environment is, it will reduce the number of breakdowns and it will allow the students to come back faster if you have tried to develop an engaging association and relationship with them.
Okay, thank you for the very comprehensive answer. So, as I may conclude, we can make good relationship with the students and also give constructive feedback. And maybe we can try, just like you said, innovative ways like giving coupon or maybe points. So, and at the end of the semester, we can treat the students, all, of course, the best students. Okay, thank you very much, Dr. Aziz. And we also have several questions on the chat box for you. Um, Hold on. Okay, yeah.
The
Okay.
first one from Mutia Wilda.
Oh yeah. Okay, so for Mutia Wilda,
It says building good relationships is challenge in countries with large power distance. How do
yeah.
you make educators who are still steeped in the culture of large power distance aware of the need to build good relationships with their students? That's exactly what I was talking about. That in our culture and in Southeast Asia, where we find, even in India, you address the teacher as sir or ma'am, and that itself, that simple salutation of sir was something which was given to somebody when they were knighted by the Queen of England, which none of us have been, but just because we are medical teachers, we entitle ourselves to that salutation. However, if we make the simple effort of learning the student's name and breaking down boundaries, it will change the culture. Now, how do I make the professors who are already steeped in the power battle, how to change their mindset? Probably when the younger generation has gotten exposure from other cultures, and when they come back and apply their newer learnings into their systems, and there is a critical number of people who have applied those learnings, the system will automatically change. And we may not be able to individually change other people. If I go to next Eureka's question, it could be how to cultivate the importance of connection in the expert-minded teachers. So once again, it's the similar kind of question, and my answer would also be on similar lines. That a teacher who does not understand the importance of relationship with their students will not be able to communicate and be able to teach their students or make their learners learn more. And once again, to do this activity, I would bring up the same question which I had during my presentation. Just ask the teacher, just ask the expert to try and think of the name of a teacher in their own student days, in their own life, whom they remember and whom they like as a teacher. And they will realize that their liking of this teacher is not because this teacher was an expert, but because that they had a relationship with this teacher. And they will understand the importance of this teacher.
Okay, and there is also another question. Would it be possible to remember all names in large cohorts? Because you
So
said that
yes,
try to say their student's name, right? So
perfect. So I will give an answer to that by an example. I never thought that learning a name was important till the year 2016. Before this time, I was learning and studying in India and teaching in India. In 2016, I had this opportunity to go to the United States for a under a fellowship for a master's in public health program. And this is a program by the Johns Hopkins University Bloomberg School. 250 students came for class on day one from different parts of the world, from different countries. There were 76 countries, and 250 students have come for class. And I can tell you that the program director who was teaching this class was Dr. Marie Diener Best. And on the first day in class, she knew every name of every student by face, by recognition. So it's not something which is impossible. It's definitely possible, but it takes effort, time, and a commitment which we don't have.
yes, I agree. Uh, it's not impossible. It's possible, but it takes time and maybe it takes effort. So it depends on whether we want to give more effort or not to remembering the student's name.
And in the United States, I saw even other teachers in other classes. They would be standing at the door, and they would have a list of names of students with their photographs. And before they would enter the class and start their lecture or their session, they would be standing at the door and trying to memorize every student's name so that they don't have a chance to fumble or ask the student's name. And when they entered class, they would know each student's name even before they started the first class. So it's possible.
Wow, it's amazing. Yeah, I think we can try to try those what is it? Those effort. Maybe not starting in a large class, but maybe in a small group discussion, like problem-based learning or in a clinical skill laboratory.
So
All right.
one trick I can tell you how to remember names, especially in a small group, it helps. Uh, so when you are in a session, let's say with about 20 to 25 students or new people in a meeting, I have tried this myself. You ask someone else to lead the round of introductions. And once they are introducing themselves, you put down their names on paper in the sequence that they are telling their names, and put some an identification mark in your notes that so that you can recognize them. And usually in a meeting of about 20, 25, 30 people, you will be fascinated, or you'll be surprised to know that you will remember most of the names if you have done this exercise once or twice. And the next time you will realize that most students will come back and sit at the same place. In most classrooms, even in large classrooms, it is been seen, studied, and found that students will come back and sit in the same place. So you will, in a couple of days, you would have known their names.
Okay, so yeah, we can try that strategy also to remember the name. So we hope that the students can go back to their seats so we can still remember their names. All right, thank you, Dr. Ashish, for the wonderful answer and also strategies that we can try to implement in our own institution. So I would like to invite all three speakers, so Dr. DC, Dr. Christian, to go back to the to panel discussion. So I already read so fruitful discussion in the chat box, but maybe for those participants who do not read the chat box, maybe they cannot understand what's going on there. So I would like to maybe summarize and the questions there is already in the chat box. So actually, most of them are asking about the strategies, like how we can implement program or innovations, or to build resilience or to help students form their professional identity, and also to maintain students' well-being, especially in the like a constrained situation like in Southeast Asia. Maybe we have hierarchy, and then maybe also tight schedule of the students, and then tight schedule of the lecturers also. So I would like to know the perspective of Dr. DC. Maybe you can also share your experience or maybe your thoughts about it.
Thank you very much, Dr. Latifa. So how we can give the resilience building to our students, but with this tight schedule. And I also agree with what Dr. Christian Edmund has already said. We can embed that program to the ongoing program in our institution. For example, early clinical exposure. It's actually not only teaching us about early clinical exposure, but how we as students, as a future doctor, can do in the clinical context. But also it teaches critical reasoning. It teaches us some new challenges that we can overcome, which will increase our confidence, which will finally increase our resilience. And we can add a reflection session at the end of the program just to know what they have learned, and we can give constructive feedback afterwards. So it doesn't have to be a new resilience building program in the new schedule, but just use whatever we have, what program that we already have, and add more reflection, for example, and constructive feedback. Maybe that's it, Dr. Latifa.
All right, thank you, Dr. DC. So we don't think too much. Just like embedded it in the curriculum. There is just like like reflection at the end of the every lecture or every learning activities. I think it's a good support for resilience building. Okay, next for Dr. Christian, maybe you can also have some thoughts about it.
Okay, maybe I agree with Dr. DC said before, and maybe our goal is not about the new content that we can put in our curricula. Maybe it's more about the intention in everyday teaching session, maybe in the PBL or the skills lab session. And I think the key is to be consistent and structured enough. So maybe the students can feel that they're not alone, and they have us as their educators. So maybe it can help build their resilience and also their professional identity. Maybe it's from my perspective, Dr. Tifu.
Sorry. All right, thank you, Dr. Christian. So good intention, and also we can also do it in everyday teaching, just like what Dr. DC said. Okay, so there is also another thought about the students' well-being. I'm gonna ask Dr. Ashish. So this is from Dr. Ita Armyati. She asked, do you agree with statement that students' well-being important in professional identity formation?
Obviously, unless there is a student well-being, or if the student has got emotional strength and his ability to be physically resilient and understanding, there is no way that he can develop or she can develop a professional identity. A player who does not have the emotional strength or an understanding will never be a player in the right kind of a team. And so I believe definitely that a student well-being is very important in developing any kind of professional identity, whether it's a nurse, whether it's a student, or any other healthcare worker in any different environment or engagement.
Okay, so yeah, that's absolutely important for for a PIF, right? The students' well-being. So related to students' well-being, as we know that our current students right now is from, maybe we can say, Z generation, or some said strawberry generation. So do you think that this personality affect their resilience skill, also their well-being, and how can we support this current generation, especially who are born in a society enriched by social media? Perhaps Dr. DC, you may share your thought.
Thank you very much, Dr. Tifa. Yeah, we'll live together with the Gen Z or the strawberry generation, who are so creative, so logical. They always demand some logical explanation so that they will follow what we say. And we have to understand that there are large generation gap between the lecturer and also our students. Sometimes uh, uh don't be selfish, like they have to follow what works in our generation, but we also have to do some approach to our senior lecturer, probably by having a regular training or faculty development, so that all the lecturers, all the staff of all the faculties understand that we are facing a new generation, a different generation than we are. So we have to adjust ourselves to them too, not only them adjusting to us. So I guess it's very important, because the way we teach later on, the way we approach them, if we're still using our own way, our own way, yeah, maybe it will burden them. Maybe they will not accept that. Maybe they will reframe that as a threat rather than us trying to help them. So I think that's important, Dr. Latifah.
Okay, thank you, doctor. So yeah, we cannot force them to adjust to our style of teaching, right? But we are the one who should adjust to how they learn nowadays. Okay, Dr. Christian, you have another thought about it, another strategy to teach your Z generation students?
Okay, in my opinion, I think maybe some of the older educator say that strawberry generation are more fragile, but I don't think so about it. Maybe they are more they different. Their challenges are different with what challenged us in our past, and so we can help them by more give them we have some patience about their activity, and we should more learn about them, and maybe what we can teach about it or the strategies, maybe we can enlighten them with some fact about how self-regulation in the digital era is important. And we'll see that maybe in Indonesia, especially, there's sometimes in the social media, there's a conflict between in doctors, and so maybe it's can uh, we can take the uh, that's that kind of problem to teach them, and then we can also strengthen the reflection practices, and it also cannot don't bother the much time. I think we can just in the chit chat when we talk with the students, it also maybe can help them. Maybe it's from my opinion, Dr. Tifa.
Okay, thank you, Dr. Christian. Yes, I agree that they also have their own challenge, right? And maybe those challenges that we did not experience as students before, because we are from different generation. And I agree that we should not judge them, and then we should like more interactive with them, chit chat, and also do reflection with them. All right. I want to hear another maybe sharing or opinions from Dr. Ashish regarding the current generation of medical students. Maybe you also have another strategies.
So I believe that the current generation of medical students are no different from current generation of our own children and the students in all the other professions. So they are just from the same society, and they are also people who are just like how they are a reflection of what's happening in the society. So treating them differently to a great extent really does not make any meaning. So if we find that they're wearing different clothes, if they are wearing different, if they are using different language, if they are using different technology, so unless and until we talk to them at their level using their technology, we will never be able to connect with them. And if we are not able to connect with them, we will be creating doctors and nurses and healthcare professionals who are ill-equipped and who are not competent to handle patient care or to handle the challenges that are involved in a high pressure situation, where not only the clinical situation demands more resilience, but also the social interaction, the response to the patient's families, the interactions with the society are also more and more demanding as the expectations of the society increase more and more from our medical students.
All right, thank you, doctor. So connection is it's very important thing that we should build with them. Well, not only for the current generation, of course, for every generation of students, we have to build connection with them, and we have to just adjust what they need according to the generation. Okay, so there is another questions. I think it's for Dr. Ashish. So from Dr. Ahmad Yarzik, how about spiritual well-being status of the student? Is there any correlation with the student resilience?
Absolutely. So what I have found over the last 30 years of observation as a medical student and then as a teacher is that those who believe in spirituality and those who do not believe in spirituality, as the examinations come near, you will find that the students will visit temples, places of religion, and they become more spiritual during the period of exams. So, 1 week or 2 weeks before the exam, you will find that all areas of worship queue up with the medical students. And as soon as the exams are over, these queues will disappear. So, spirituality definitely has an anchor which holds our students and gives them the support that they require. And this is also a positive in our Southeast Asian cultures, especially where people are more religious and people accept their fate, whereas in the West, this doesn't happen. And so mental health issues increase in those areas also. And spirituality definitely has a strong support and has a chance to anchor our students to give them more resilience, more strength, and more ability to understand and hold back. I see Patricia Dissy has her hand up.
Okay, may I add to this point,
Yes,
Dr.
please.
Latifah? Yeah.
Yeah.
So yeah, I also believe that spiritual well-being is one of the most important internal factors that influencing resilience. In the framework, you see that one of them is spiritual, and it talks about how you have a purpose in life, how you believe in higher power, how you keep your motivation. And I held a qualitative study in just this year in my institution, and I interview some of the students with low and high resilience, and they always mentioned about how God has a really great role in their resilience, and sometimes they involve in organization based of religion, so it's outside the curriculum. So they worship together, they strengthen each other, and it is one of the reason they keep going in this medical school, because sometimes they live far away from their family and they feel closer with this people with the same belief, and because they strengthen each other by prayers. Like, thank you, Latifa.
All right. Thank you, Dr. Ashish and Dr. DC. So yeah, spirituality is really important in building resilience. And it is also in the resilience framework that Dr. DC already shared before. And really it turns out that spirituality bring positive impact to the resilience of the students. Okay. We have another questions in the chat box regarding the flood disasters that already happened in Sumatra. Perhaps Dr. Aziz also heard about it. We just get hit by the flood disasters in Sumatra Island. So it might be intensify academic pressures. So how might institutions balance the need for academic continuity with compassionate approaches that safeguard well-being of our students? Perhaps Dr. Ashish have a
Yeah, so I believe that disasters and natural calamities, whether they are human or man-made or nature-made, are going to be a part of our lives more and more. In the entire world, if you look even in the Southeast Asian region, Sri Lanka is fighting a storm, Ditwa. The Hong Kong had this huge fire which broke out, and an entire complex of residential complex was gutted in fire. And wherever this kind of a calamity strikes, or wherever this natural disaster happens, everyone is going to land up in hospitals. And it's the patients and the number of patients which will increase. There will be disruptions in medical education. There will be disruptions in clinical care. And unless we have students who are resilient and who are able to help out in these kind of situations, we need to involve them rather than reduce the interaction at such times. These problems and creating probably weaker doctors will continue to compound and increase. So we need to improve our search capacities at these times, and we need to increase the clinical care doctors in the environment as well as the students. COVID taught us that education can continue with an online mode, at a distance mode, and with the technology which has established. Maybe if COVID had not happened, probably we would not have been having this webinar on Zoom today, and we would be looking for a real physical engagements and possibilities and avenues. But this is how technology has led us, and probably we will be delivering more and more care on telehealth in times of need and requirement in the future. Yes, that's all I have to say.
All right, thank you, Dr. Ashish. So yeah, natural disaster or human-made disaster, we already proved that especially in medical education, we still can maintain it, and then also we can still have a good learning environment, although we have in a pressure like in a disaster. So yeah, and of course we now have a online webinar or also telehealth, and it's some of the good points from the disaster. Okay, we have a participant who raised hand. Please, Dr. Hanifa, you
Yes,
can ask the speakers.
thank you, Latifa. Hello, Prof. Ashish. I just want to share my like experience in disaster management, because our students at the last semester at the profession residence, they have to go to a place that there are disaster in there. They have to go to Aceh, Medan, and Padang. All of my students go there and uh, bring all the they knowledge, yeah, to go there to apa namanya have a duty, have duty to the people. And I want to share about the resilience. The resilience we have to build the resilience to our students because they don't have parents inside them. They are in the boarding school, and they have to have encouraged from me as a leader of the study program. So I agree with you that the resilience should build not only with themselves, but also have a good doctor or good teacher to surround them and give them encourage to make a duty like that. This is very good
Yes, I
insight for
completely
me.
agree, Hanifa, that at
Mhm.
the times of these disasters, we do not need to shield our students, but we need to make them stronger to be able to
Yeah,
participate and help out in handling and managing these disasters
yeah,
at
yeah,
times when there is need.
yeah. That's all, Latifa. Thank you.
Yeah, thank you, Dr. Hanifa. Yes, I agree, and actually it's a good opportunity for the students, not only to communicate or just to serve the community, but also to build their professional identity and also resilience and well-being. And how can they survive in those disaster situation, post-disaster situations? Okay. Uh, is that any questions from the participants? Maybe you can raise your hand. Um, okay, if not, maybe I want to ask for each speaker to give closing remarks from Dr. DC first, please.
Okay, thank you, Dr. Latifah. So the closing remark will be, I would like to ask every one of us to reflect. Have we become a safe place to our students for them to tell their problems, or even are we sensitive enough to know that our students need help? Because by being the person that care, that have compassion, you guys, ladies and gentlemen, can help them to improve their resilience. Thank you.
Thank you, Dr. DC. And next, Dr. Christian, please share your closing remark.
Okay, thank you, Dr. Tifa. And maybe I want to remind us that we know that identity formation takes a village, and let's each of us plays a part in our students' professional identity formation. Maybe that's for me.
Okay, thank you, Dr. Christian. And last but not least, please, Dr. Ashish.
So my take home message and final closing words will be: get a relationship, know your students, mark your words. What you say is more important than what you teach, how you teach, and show that you care for your students. Grades are not important, and learn the tech and the lingo that the students are speaking so that you can speak to them better.
Oh, wow. That's very deep take-home message. I will bring it really to my home. Thank you, Dr. Ashish, and thank you everyone, all speakers, for your insightful contributions, and thank you to all participants for your very active engagement throughout the session. I really appreciate it, and we hope today's discussion encourage all of us to continue strengthening supportive learning environments for the well-being and future success of our students. Now, please allow me to share a very interesting information. Don't miss the opportunity to become part of the FAMER Friendship Fellowship 2026 at Universitas Gadjah Mada. It is a 2-year blended learning program designed to strengthen leadership and educational innovation in medical and health professions education. This fellowship will give you opportunity to connecting you to a global FAMER network while developing practical skills to lead change in your institutions. Well, in fact, 4 of us are friendship fellow. So you may see that we already bring connect to a global FAMER network. So, and just a friendly reminder for all prospective Friendship 2026 fellow. So for those of you who already registered, Please complete and submit your online registration form and required documents before 31st December 2025. So before the year change. And before we end the webinar, I would like to ask all the speakers and audiences to have picture together. So I would like to invite everyone to turn on your camera so we can see each other faces, beautiful faces. And maybe I would like to ask the camera to help me to screen capture.
Oke, Mbak Latifah.
Okay. Maybe you mail it, Mbak Aan.
Yes. 3, 2, 1. Yeah. Next slide. 3, 2, 1. The last. Oke, thank you Mbak Latifah.
Okay, thank you very much for your participation, everyone. Have a wonderful day and see you in the next MHPE Friendship webinar. Bye-bye.
Thank you so much, everyone.
Thank you very much, everyone.